Folks, thanks for joining us today. My name's John Dubas with Premier Marketing. We'll be spending the next 55 to 60 minutes or so discussing a topic that is kind of a double entendre of sorts, and it is visiting with folks about getting started with Medicare. This includes the approach to the population we serve within the Medicare community, but also gives us an idea as insurance agents how we begin to acquire the knowledge we need to properly communicate with the folks within this market. And so what we'll do today is visit about that very topic, include information on a presentation that is taken from the Medicare Learning Network that gives us the information to communicate with the community. And it is one of a number of presentations that are available. And we'll highlight a couple of others as well. But wanted to make certain that you had the information you may need to review the benefits yourself overall and to set up an approach for the population that we are targeting within the Medicare community. You'll notice that the software package that we're using for this broadcast has a section for both questions and for chat. We ask that you put your questions in the questions box. We find that for the most part, we generally address them through the course of the presentation, but we'll make certain that we directly address any questions that haven't been covered and make certain that we enhance the return of your investment in today's webinar, the time that you're investing. You'll notice also that today's presentation, perhaps you don't, but it is, today's presentation is being recorded, and the recording, as it updates, will be posted on our website at premiersmi.com and on our YouTube channel as well. Those that have raised their hands with interest in today's presentation will be receiving follow-up from us, an email that includes a link to that presentation and links to some of the other information we'll reference as we go along. What we'll do, however, is start with a bit of follow-up about, or level set about, who Premier Marketing is. For those that aren't as familiar with our organization, we are a national marketing organization founded in 1968. It's part of the Integrity Marketing Platform with offices across the country, licensed in all 50 states, acting as an insurance wholesaler through independent insurance agents such as yourself, with contracts available at the highest possible commission levels and recruiting contracts available to those who qualify. We offer a full portfolio of products to achieve this means, and that includes the base programs for the Medicare population, the Medicare Advantage and Medicare Supplement plans, and the standalone Part D prescription drug programs. We also have a full portfolio of life insurance and final expense products, pre-need plans, long and short-term care programs, disability income programs, and the ancillary benefits that add to many of the coverages that folks need that may be a shortfall in their base medical coverages, such as dental, vision, hearing programs, critical illness and cancer plans, hospital indemnity programs, accident and telehealth programs. The Medicare Advantage program includes the national carriers that are there for you, along with many of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the prescription drug arena, where those national carriers are there for you, normally part of the MA contract that you may have with the carriers to offer that product. One exception, Mutual of Omaha, separate contract from some of their other programs, not part of the same contract they have with Medicare Supplement and ancillary programs, so a different piece there, only PDP. And the Clever RX program listed here is actually a discount program for prescription drugs. When we look at the Medicare supplements, full portfolio of products, systems put in place to be able to ascertain which are competitive in your market and are necessary to cover the whole gambit of the Medicare population, no matter what their income is, basing what we offer as part of what they need. And I think we'll see that illustrated through today's presentation as well. Ancillary products in each of those categories, you got the national leaders there for you that can make a difference for you in your market. Added one recently, hasn't been on the list yet, and that's a national general product. When we look at the Medicare market overall, we see a burgeoning market and near exponential growth in the number of folks that are eligible for the program based on age. Medicare starts generally for the folks that are 65 and above, with some exceptions we'll talk about in a moment. And we can see that there's a whole lot of people on Medicare, more coming with the aging of the completing of the aging of the baby boomers. But if we look at it based just on age, we may be looking at a population that is not currently defined entirely by age. There are folks turning 65 that are deferring full enrollment in Medicare for one reason or another. Some may continue to work because of the pandemic and some of the influence that has had on savings and other factors that allow us to retire. The lengthening of the time that we have with Social Security in order to be fully eligible for all the benefits we have there to get our full retirement, pushing it up to age 67 here for folks born in 1960. And so we see a number of people that are eligible but not accessing all the benefits. So we look then to see what is the true size of the market, and we realize that 15% of the market in Medicare, well, they're under the age of 65, accessing benefits because of age or disability, and instead of age, disability, and that really pumps the number back up. It is a diverse population, and one that you'll see as we go through some of the presentation today, how it addresses the entire population. Much as what we hope to do today with the webinar overall, we're looking at the entire picture. And when you look at Medicare recipients, well, 2/3 of them have 3+ chronic conditions. You got some challenges with income and assets. So we want to make certain that we're able to offer whatever we need to offer to help with any of the choices that they take. So as a general overview, folks coming on to Medicare have a number of options they can do. They can defer the Part B optional medical benefit. We'll talk about that in a little bit. Most don't, thankfully. Some will self-insure for the shortfall in the financial protection area, shall we put it that way, where they're liable for different expenses on the base coverages, but they'll pick up a standalone Part D program to help with the medicine and the cost of the prescriptions. Some will take out a standardized, modernized Medicare supplement program to cover the deductibles and coinsurance on the base medical, and then add on the Part D benefit because they're two separate programs on that side. Others will bundle and go into Medicare Advantage and look at the entire package of benefits all together. So in each of these choices, we want to make certain we have the product there to help them, but we also understand the differences between these choices and help people get the information they need to make a proper choice. Because, well, in the past, they've been pretty even between choosing between Medicare and Advantage and Medicare supplement programs. You see a number of folks that will stay on original Medicare only. That doesn't mean they have just Medicare. That percentage is in there, but there may be people in there that are accessing benefit through the VA, through retirement, through unions, for whatever reason there may be, that they're not coming up in the other categories, dual beneficiaries, Medicare, Medicaid folks. But the pandemic has kind of changed that mix just a little bit. What we see here is more people becoming involved with the Medicare Advantage plans. Might be because younger people aging into Medicare are more comfortable with network-based programs. They like the electronic aspect that is advertised ad nauseum on television. Whatever it happens to be, we need to be aware of choices that are coming in and what we need to address the folks and the coverages that they need. One of the things that comes around with that, and for those of you that might be newer to this arena, is, boy, oh man, do you have a lot of acronyms or what? Well, one of the things you'll receive as a part of the follow-up that we send is a guide, a link to this acronym guide provided by the Medicare Learning Network, a governmental site that gives us the opportunity to speak to folks in a language they understand, defining what all these acronyms are. And it reminds us to look at our presentations and realize that we should minimize the use of acronyms simply to make certain that folks understand what we're talking about. This helps us do that. Medicare itself is set up and regulated by a number of organizations we'll discuss, but the election periods that are put into play on a standard basis, we're in the OEP right now, the open enrollment period, where people on Medicare Advantage plans can do a bunch of switching, not a lot of other activity based just on that. But folks aren't necessarily locked in completely because they are a Medicare beneficiary. They have special election periods that they can use to change coverages, much as what you see in the under 65 market, if you're more familiar with that. A whole number of them. And extra ones that come into play because of weather and other circumstances. Just saw a renewal for the state of Texas because of COVID with a SEP, an SCP, a special election period for that. So you see with this number of exceptions that you have is, well, the majority of people on Medicare will qualify to change coverage throughout the year. It's a question then, is this the best thing for them? So what we want to do is make certain that we get them the information they need in order to review their coverages and take advantage of other coverage should it be in their best interest. Because during the annual election period, the free-for-all from from October 15th through December 7th, folks aren't doing it. A whole bunch of people out there on Medicare, regardless of their base underlying program, that they haven't done annual reviews, and the particularly vulnerable portion of this population may be more suspect to that as well. So we want to make certain that we help them because there are changes in programs year over year, particularly when it is influenced by one, network, but two, the coverages for the medications, be it in a standalone drug plan where altering the course of action within that is based on monetary basis for the most part, for one reason or another alone. But Medicare Advantage plans that have the medication coverage integrated into it, well, changing that is a little different because it involves the research on the physicians and the other health benefits. Folks aren't reviewing. We can help them in that regard. They're not using the government sites to do it or the other ways that they receive information from our country in order to make them aware of the choices that they need. So we need to get them information in a manner that they are open to receive it as well. Sometimes that's still a tactile situation. Some folks want a packet still at this particular point in time. And some folks want to discuss the options they have in person or virtually, or a combination of that. We can use systems that can help us reach as many people as possible in a timely, compliant fashion. And so having software can make a big difference in order to deliver upon this, be it the presentation software where many people are using Zoom meetings, or also, and more importantly, in many circumstances, is getting them the information about the choices that you've discussed in a manner that keeps you compliant but thorough in the delivery of that information. Because, hey, they're used to it by now. Folks are, well, they become much more accustomed to receiving information electronically. We've trained them through the pandemic with the use of a doctor visit virtually, be it specialist primary care. Hospitals are using systems this way in order to expedite and take care of basically other needs they need for a hospital stay. Same thing with dentists. We're even seeing it in other aspects of our life where many people celebrate their faith through services that are done electronically. So the Medicare population is becoming much more open to receiving information this way and are becoming much more adept at interpreting it. So when we look at getting started with Medicare, we take all this background that we just ran through and we make certain that we have our P's and Q's in order, ducks in a row, however you want to say it. We're prepared for those discussions. And so we want to make certain that the repositories of information, be it our organization, the governmental websites, whatever it happens to be, we know how the data we need in order to properly serve this population and work it to our advantage as independent insurance agents with agencies we're looking to grow and that we live on through. So one of the things that you'll see is a presentation made available, one of the presentations by uh, the National Training Program through CMS. So this is a presentation where the PowerPoint has been developed and made available to us through this organization. There's a ton of these out there, in all honesty, with different carriers providing their own piece through Medicare 101 pieces. You also have organizations like ours that put out a Medicare 101 piece, getting started with Medicare, your Medicare choices, a number of them with different titles, all lipstick on a pig, to be honest. But this one is a very thorough one, and it goes through a number of different highlights of different portions of it. So we're going to take a peek at this really quickly and run through it with a little bit of asides upon occasion on different slides, the first couple sections of it. I say that because in anticipation of this webinar and other presentations, we have done some preliminary work to see, one, just how long can this go on? How long is this presentation? Because it's the old, the mind can absorb what the butt can endure kind of thought. So we're going to run through that with you here in just a second. One of the things I want to show you, however, is how these programs, and bear with me, another type of presentation put together by Premier and Integrity that goes through and speaks to these different choices. This is available to you. There is also the different pieces that come into play, all from the carriers, United Healthcare, Aetna, Centene's organizations, Anthem. Pick out any of the big boys and many of the strong regionals, and they'll have a presentation that goes through this and speaks to the basics. This gives us that opportunity to make certain that we don't have to recreate the wheel. The information we're giving is complete, factual, set up and vetted by the organizations, and we don't have to start all over with it. I know a lot of us really are blessed with a bit of creativity, some of you more than I, and in different areas, but we want to make certain that the procedure we go through is made available to you. And so you'll see this as part of what we will do. I'm going to leave it in this format to a degree because it'll show you then just what we're speaking of. What I talked about a little bit when it comes into the agenda of these programs, and that we're only going to touch upon a couple of them in today's presentation, is simply because of the length of some of this. So as you go into the community or you visit with people electronically or face-to-face during seminars or webinars or whatever it happens to be, it's a great presentation, but you might consider offering it in little chunks, giving an overview as to what is Medicare and speak to original Medicare and the Part A and Part B components. You then have choices thereafter that will concentrate on some of the specific coverages. You'll see that some of those are shorter, so we're going to attempt to get through as much of this as possible without me completely blathering on to give you an idea as to how this works. One of the really nice pieces about a presentation like this is it does give you information talking points below the slide. If you go into a view function on this alone, it would show you only the large part of the screen and not the preview. And that's the way most of these presentations are completed. So as we speak to what is Medicare, these sections will give us an idea as to how we compare the parts of Medicare and the coverage options that are available. They'll help explain benefits and costs. It'll compare original Medicare and Medicare Advantage as we've seen. As part of the agenda, it will discuss how Medicare supplement insurance, Medigap policies, and Medicare Advantage plans are different, and how the health insurance marketplace and people on that nearing eligibility what they need to know and what they need to do in order to put this coverage in play. It's also a way for us to recognize that there are assistance programs for people on Medicare based on income and assets that can help with some of the shortfall as well. Knowing that detail can really make a difference for you, because you note in an earlier part of the presentation that, hey, half the population is about 28,000 now per year and below. Sometimes economics comes into play as to what choices they can afford for additional coverages. And these programs can help people in that regard, be it with the low income subsidy only for medications, or for the Medicare savings programs or Medicaid overall that can help with overall expenses. When we look at what's Medicare, it's a health program designed for people 65 or older, or for folks under age of 65 with certain disabilities. A couple of those underlying conditions that make people immediately eligible for Medicare, well, one is Lou Gehrig's disease, amyotrophic lateral sclerosis, and end-stage renal disease, ESRD, program affecting the kidneys and the cleaning of our blood. So what this does is it gives us an idea of that 15 to 17% of the population under the age of 65 accessing benefits before that date, potential reasons why they have that coverage. And in order to have Medicare, you must be a United States citizen or be lawfully present in the United States for at least a period of 5 continuous years. So that gives us an opportunity to visit with folks across the board that need coverage that may or may not be eligible for Medicare itself. It is a program that is governed, has oversight by a number of different organizations. When you look at the handling of the enrollment and the premiums that come into play with the cost associated with original Medicare, you see that Social Security enrolls most of the people in Medicare. The webinar yesterday that spoke to the unique marriage between Social Security and Medicare. But that is also handled by the Railroad Retirement Board for those folks that are railroad retirees working into Medicare, and the federal retirees that are handled by the Office of Personnel Management. We've seen recently where some governmental agencies are being asked to, well, or potentially put into Medicare versus some of the coverages they've had in the past. And I'm referring to what's happening with the post office at this particular point in time. We do also have the overall oversight by the Centers for Medicare and Medicaid Services, CMS, that handles oversight across all states. So we need to be aware of the fact that there are a number of different governmental agencies that come into play. And if we fold in some of the assistance programs, we have the different states that have a hand in the process as well. The different parts of Medicare, the basic ones that we see, Part A is the hospitalization coverage, Part B is the medical coverage, Part D is the optional part that covers prescription coverages, drug coverages. And what we have then is a bit of a difference in the delivery of the systems if someone chooses to stay in original Medicare versus enrolling in a Medicare Advantage plan, which is an option they have to do on their own, a decision they must consciously take. With original Medicare, a Part A and a Part B coverage comes as a part of the general package that most people utilize. Most enter into an arrangement with a private insurance company to provide the Part D coverage, the medication coverage, and then some folks that stay within original Medicare administration will pick up a standardized, modernized Medicare supplement plan with the choices that are available in their state and the regulations that come into play there in order to cover the financial shortfall in the base coverages. These people, if they take out a Medicare supplement plan, most generally will have a Part D program as well in play, unless there's some other coverage that they're receiving that help in another fashion. It's very important to note that that line between original Medicare and Medicare Advantage definitely does affect the effectiveness or the reason why someone would take out a Medicare supplement plan. Has to be with original Medicare, doesn't work with a Medicare Advantage plan. And what I'm referring to here are the standardized, modernized options that people have with Medigap's. I'm not talking about a fee-for-service program, like a hospital indemnity program, or something else designed for a specific purpose that pays in addition to any other coverage. Medicare Advantage plans, well, they're kind of like the American picker model of, hey, we bundle. They push the Part A and Part B coverages together, funded through a arrangement with a private insurance company and the government. And the majority of these plans integrate in the medication coverages. The Part D coverage comes with it. And these are the programs we hear advertised on television ad nauseum by celebrities or past celebrities that go in to speak to the extra benefits that may come with these programs as well. So dental, vision, hearing coverage, transportation coverage, over-the-counter coverage, a number of different extras that will vary from market to market and plan to plan within the different carriers, even themselves. These programs have a lower out-of-pocket cost than just traditional Medicare based on the fact that they have a maximum out-of-pocket that can be spent during a calendar year. Original Medicare by itself does not. A moot point if they take out the supplemental coverage through a Medigap policy, but original Medicare doesn't have a maximum out-of-pocket. Medicare Advantage plans do. There's a big choice as to how that care is delivered as well. And this is a big difference between staying on original Medicare and joining a Medicare Advantage plan. You don't hear a lot of this in some of the advertisements we see on television, here on television. Some of them will allude to it briefly. They tend to concentrate just on the benefits and not, hey, what are the inherent costs? It's not just a premium, it's how we receive the care. With original Medicare, the beneficiary can go to any doctor or hospital that takes Medicare anywhere in the United States. And in most cases, they are not required to have a referral to see a specialist because of the coverage. I put it that way because there are certain specialists that will only see anyone based on a referral from another doctor. So a bit of a splitting of the hairs there, but the coverage doesn't require a referral in order to see the specialist. And on the Medicare Advantage side, there are network-based programs that come into play. So in order to access care, the beneficiary needs to use the doctors and other providers that are in the plan network for non-emergency care. Much as what we see on the Medicare supplement side, where some med sups are med select, and in order to receive full benefits on a planned procedure, they need to use a particular facility. We don't see that as much anymore. On the Medicare Advantage side, in order to have the coverages on a non-emergent basis covered, it has to go through the network. That's important to note because it's all aspects of care by all providers that are billing the government, billing Medicare for their services. So not just doctors, not just hospitals, but we need to take into account durable medical equipment companies, home health care organizations, things of that nature that are part of that overall network. These plans do have some coverage for emergency or urgent care based on the plan itself. Details can vary according to plan choice. And these programs may require a referral to see a specialist or go through a prior authorization process for other types of care as well. When we look at overall cost, we kind of alluded to a non-out-of-pocket cost when we talk about delivery of care through a network or not. But with these programs, if you lie them out, the two options that you have here, staying in original Medicare, enrolling in a Medicare Advantage plan, under original Medicare, the Part B covered services, the medical services, well, there's a co-insurance, 20% of the amount of that Medicare approved payment number that is the liability, the financial responsibility of the beneficiary. So that 20% is the co-insurance. There is a premium for Part B, and this is the medical coverage that has a contribution from the beneficiary themselves. It took a historic jump from 21 to 22 of 15%, up to $170.10 based on a person's income. We'll go through greater detail on that in just a moment. But if a person wants to have medical coverage and prescription drug coverage, they got to join. They need to join. Gotta. Boy, that's really great. They need to join a Medicare drug plan that are offered by a number of different private insurance companies, and there is a premium associated with that coverage as well. That is the responsibility of that individual. As I mentioned, there's no yearly limit as to what an individual has to pay out of pocket for costs that aren't covered by one program or another. Medigap's Medicare supplement programs can take care of that in a great deal. Depending upon the type that you have, it can be very comprehensive in the coverage as well. And it is important to note that that covers that co-insurance and may well cover many of the deductibles that are necessary as well. They can be covered too by retirement coverage, by the VA, some of the other things that people will do to cover some of that financial shortfall, but there is financial exposure of that means within original Medicare. With Medicare Advantage plans, it'll vary from market to market, plan to plan, area to area, where those out-of-pocket costs can vary, and it can be different for different plans in different markets. It does require Medicare Advantage programs that the person does maintain their Part B coverage. It's one of the eligibility factors for the program, and they continue to pay that Part B premium unless they qualify for other assistance. An individual may be liable for additional premium for the plan itself, the Medicare Advantage plan. There are programs out there that will charge a varying premium depending upon the plan type. The majority of the programs that are offered in most markets, however, are without additional premium. As J.J. Walker says on his commercial on television, it's free. Well, you know how that works. There are co-payments that come into play for the coverage as well. These programs do, however, have that MOOP, that maximum out of pocket that is set by the government, dictated as a limit to the programs as they create their benefit packages year over year. This is a number that has changed each and every year, edges up a little bit, but that is the max that a person has to pay in that program out of pocket for that calendar year. It's important to note these coverages, as I mentioned before, do not work with a Medigap policy. In order for a Medigap policy, a Medicare supplement policy to pay, they pay based on what Medicare pays. So if Medicare covers it, depending upon the plan type you take with a Medigap policy, it'll pay up to that amount and take care of it. If Medicare doesn't cover it, Medigaps don't either. In the Medicare Advantage side, Medigaps don't apply because you're not filing with original Medicare. It would be a filing with the Medicare Advantage plans. Don't work together. And technically, well, not even technically, it's against the law for you to sell a Medicare supplement program for someone on Medicare Advantage if they're choosing to maintain their Medicare Advantage coverage. So some things we need to be aware of as to what our choices are when we, as Yogi Berra says, we come to that fork in the road and we take it one way or another, it will tell us what things cost. When we look at the coverages themselves, we mentioned that original Medicare covers the basics in hospitalization and medical through A and B coverages. They don't offer many of the extras that you see, and some coverages many people would feel would be standard for coverage with health insurance are not covered by original Medicare, such things as eye exams, most dental care, routine examinations. And as I mentioned, you have this type of coverage, you need to take out a separate Medicare drug plan in order to get the drug coverage itself. Once again, though, no referrals necessary in most cases, no prior authorization, things of that nature. In the Medicare Advantage world, however, all of those coverages, the medical, the hospitalization, the extras, come through the plan themselves and the network that they have contracted with to supply that coverage. Those extra benefits are a big point of competition between the plans themselves and in the market overall. You have seen many of the extra benefits come about as a part of the social determinants of health. So we see things that are meals post hospitalization stays or transportation benefits, in addition to a lot of the things that you hear about dental, vision, hearing, and on some of the other extra benefits. Drug coverage generally is integrated into the Medicare Advantage plan itself. So you'll see those programs labeled MAPD, Medicare Advantage Prescription Drug Plans. For the programs that don't have coverage integrated into them as a Medicare Advantage plan, that is actually considered an opt-out of Part D, and you can't take a standalone drug program for most Medicare Advantage plans and make them work together. One advantage of that is it's a singular card, pretty simple package in order to do it. Once again, there are, in certain circumstances, referrals necessary for care across the board. We also want to look at the foreign travel aspect of these programs, because many folks, well, hey, when we retire, we look forward to traveling. Hey, we're going to travel abroad. We're going to see Europe. We're going to see Australia, wherever we happen to go. What's important to note with original Medicare, it doesn't cover care outside the United States. Some of the Medicare supplement plans you can purchase to augment that coverage may have an opportunity to help an individual with claims outside of the United States. Some coverage, generally limited to a specific dollar amount. On the Medicare Advantage side, they don't cover routine care outside the United States either, but they may offer coverage for emergency or urgently needed services. And you'll see many of these plans now kind of morphing into, hey, we're going to help you outside of your home service area, be it within the country or taking that around the world. Enrollment in these programs. This is finally where we're getting into the part of getting started with Medicare. How does this happen? Well, there are certain individuals that are part of an automatic enrollment process for both Part A and Part B. And this comes into play for folks that are already pulling benefits or pulling what is due to them through Social Security or the railroad retirement benefits that they have. This is a way that the government has in order to receive payment for these coverages, but it also tells that in the governmental agencies involved that the person is going into Medicare and that 3 months before the 65th birthday month, that birthday month, and 3 months after, or in the 25th month of disability benefits, folks receive a getting ready for Medicare package. And that includes the Medicare card that they use to access services if they stay with traditional Medicare only. Folks at this point in time can keep the card, accept Part B, begin the payment of their Part B premiums, whatever that happens to be. We'll give more detail on that in just a second. But what that does is it tells us that that person is accessing full Medicare benefits. If an individual was to refuse Part B for one reason or another, and there are some good reasons to do so, there are instructions on how to do that in that getting ready for Medicare package. It's important for the folks that stay with original Medicare that they carry this card across the board wherever they go, because it is the proof of insurance for doctors, hospitals, and other providers when that need arises. And these cards can be replaced through a number of fashions, actually. Medicare.gov urges the folks to create their own personal secure account. And by doing so, you can not only track certain things that are going on with your Medicare coverage, but it gives us the opportunity to log in, access the card, and print a copy for ourselves as well, should we lose it or feel we need an additional copy. We can also receive one by calling 1-800-MEDICARE, and they'll send one out to the folks as well. There are people, however, that qualify for Medicare that aren't automatically enrolled in these base coverages, and people need to do something to put it in play. And so If that is an individual that isn't receiving Social Security benefits already for one reason or another, or monies from the Railroad Retirement Board, you, as a Medicare beneficiary, need to visit socialsecurity.gov in order to initiate that process. The enrollment that is alluded to in this slide is not to get your Social Security benefits. It's to get the ball rolling to make certain that you have the underlying coverages for Medicare. Same processes can come into play with Railroad Retirement Board, but that's a call to that organization. What we're seeing with some of these differences, why some folks need to take action and some do not, is a disparity now between the age for receiving full Social Security retirement benefits and the folks that are generally eligible for Medicare. Medicare eligibility starts at age 65 for folks, plain and simple, across the board. Full retirement benefits for Social Security, not so much anymore. Depending upon your age, it can go up to age 67 before a person will receive full retirement benefits based on their own circumstances. So we see a little bit of a disparity here, and what we have are for folks that are enrolling in Medicare at age 65. Well, normally those premiums are deducted from their Social Security benefits each and every month. There are other arrangements that must be made in order to cover that premium. For folks that don't have Medicare, there are specific enrollment periods we really need to be cognizant of in order to avoid financial penalties and coverage penalties, in a manner of speaking, to make certain we can get into Medicare at the appropriate times. 3 different periods: an IEP, an initial enrollment period, a special enrollment period, an SEP under certain circumstances to get into Medicare, and the general enrollment period, the GEP. What I'm referring to here is the opportunity and timetable that an individual has in order to get into Medicare itself. I'm not referring to some of these same periods that we might see with folks that have original Medicare that look at the open enrollment period, sometimes referred to as the annual enrollment period. And this is the time between October 15th and December 7th. Take advantage of the Medicare Advantage OEP, open enrollment period. That's the first 3 months of the year, we alluded to briefly, and then different special election periods that allows the individual on Medicare already to change their coverages throughout the year. That's the piece I alluded to earlier, with over 20 of these available for the Medicare beneficiaries. So a couple of different enrollment periods we need to be really aware of and look at in order to help people that are coming into Medicare and making certain that they're doing it in a timely fashion. That is a time period, the IEP, where the initial enrollment period allows the individual to enroll or join Part A and Part B. They can time it with the additional coverages for the medications in Part D or enrollment in a Medicare Advantage plan during that same time period. And doing so through this 7-month period makes certain that there aren't any late enrollment penalties. This is also a time period where people need to be aware of the fact that this allows them to pick up additional coverages without underwriting. Medicare Advantage programs are not underwritten. They have those 2 health conditions that come into play for coverage. It doesn't affect enrollment any longer. When I first started a number of years ago, both of them did. So if they had end-stage renal disease or hospice care, they couldn't enroll in a Medicare Advantage plan. Long changed since then. However, these time periods we need to look at, while Medicare supplement policies in many cases are underwritten unless someone enrolls during a certain time period. The IEP for Medicare itself is one of those periods. And this is that time period of 3 months before the month that a person turns 65, the month the individual turns 65, or for folks that delay for one reason or another, they have the 3 months after their birth date. Communication generally goes out to everyone that is in this demographic. We all know that sometimes we don't read all our mail, or we don't check all our email, or whatever it happens to be, or having the knowledge of the fact that a person that is 64 years old with 9 months behind them as well, they're entering into their IEP. The special enrollment periods that I referred to here are not special enrollment periods to change coverages if you're already on Medicare. We'll talk about that. We have a little bit already, but some other illumination on that in a bit. This special enrollment period is an 8-month period where a person can enroll in Part A and Part B, usually without late enrollment penalties. And to do this, to take advantage of this, once the person has those underlying coverages, that's when they can pick up a Part C program, the Medicare Advantage plans, or the Part D programs, the medication coverages. This is also that time period where an individual that's looking to buy a Medigap policy, well, they've got 6 months after their Part B effective date to do so, having the underlying Part A and Part B coverages to do so and pick up that policy without any time limit upon it. I mean that by no prior conditions come into play, no underwriting comes into play during this time period. There are similar pieces of open windows like that for Medicare Advantage plans that can be different in different states and different birthday months or whatever it happens to be, but that's the period there. What we see with general election periods or general enrollment periods, the GEP, this comes into play for folks that didn't take Medicare coverages out when they were first eligible. So this is the first 3 months of the year where a person can sign up for Part A and Part B. If you don't have enough quarters in for premium free Part A, well, there are ways to buy into the program as well. And this gives us then the opportunity to get that coverage underway, and it then becomes effective on July 1st. The individual may be subject to late enrollment penalties that have taken this into play. It's also the time period then, even before these coverages are in effect, where a person can enroll in a Medicare Advantage or the drug programs, the Part D programs, that then come into effect as the base medical coverages with original Medicare come into play. Remember, those are requirements for those programs for enrollment, so you got to have A and B in place, so you can't have them active before A and B is active. The open enrollment period for people with Medicare, this is the time period that is the end of the year extravaganza where anybody on Medicare can make changes in their coverages. Medicare Advantage prescription drug coverages. This is a time period where we see a lot of change for folks on Medicare supplement programs as well, but those programs are not subject to the lock-in, so technically this isn't as big a deal for them outside of their drug coverage. It's a 7-week period every year where the Medicare beneficiary can enroll in, disenroll, or switch Medicare Advantage plans or Medicare drug plans. It is the program I referenced earlier, or the opportunity that I referenced earlier, where the majority of people aren't doing their annual review, which really brings our presence into play because, hey, they need to. It can be expensive if they don't. This period that we're currently in, the Medicare Advantage open enrollment period, is an opportunity for people on MA plans to change coverages. They're in an MAPD plan, Medicare Advantage prescription drug plan. The formulary changed on that plan that they had been on. They didn't do a review before the first of the year. Now they can do one and switch to a different Medicare Advantage plan should they choose to do so, or go back to original Medicare and pick up a standalone prescription drug program. It's not an opportunity to extend that annual election period from October to December 7th and pick up an MA plan if someone's on original Medicare, or add drug coverage if they're just on original Medicare, or switch drug plans. That's not the intent of this time period. It's a time to move between Medicare Advantage plans back and forth, perhaps. It's a one-time change during this time period. Those special enrollment periods that are we briefly alluded to earlier, well, one of them that really is focused on by the government is the 5-star program, and that is a rating given to programs based on how the plan performs, satisfaction within the plan, things of that nature. And this is a SEP that will run, well, the rest of the year. That's not part of the annual election period. These ratings are given once a year. They're normally assigned in October, effective January 1st. We can find where they are by using the plan finder under the Medicare.gov program. You do the same thing within our Medicare Center program as well. And you'll find that the carriers that offer these programs aren't shy about talking about them because it gives them that opportunity to change throughout the year. We mentioned the other special election periods that an individual has. Some of the most common ones are listed here: a person moving from one service area to another, a change in monetary circumstances or the subsidies that come into play that help them with costs, a person entering or leaving a long-term care facility, the folks that may have picked up the base coverages through the GEP and the timing was a little off and you got a retroactive notice on that. It happens upon occasion. Those folks have that special election period. And then, of course, folks that are leaving or losing employer or union coverage voluntarily or voluntarily, those are the ones we see used most frequently. It gives us then the opportunity to examine our own knowledge of this and help people understand these differences. So you have these little quizzes throughout this presentation that speaks to, well, why is the IEP important? A, B, C, or all of the above? In this circumstance, all of the above. When we look at the specifics, however, on original Medicare, and this is the last section we will cover briefly before we go and tie some things up. We'll revisit some of the other parts of this presentation, and you will be receiving links to recordings of presentations across the board as part of the follow-up, in addition to the link of today's webinar. But A and B themselves, A is the hospitalization coverage that covers medically necessary services delivered on an inpatient basis with certain limitations, be it through a hospital or inpatient care in a skilled nursing facility. The SNF coverage, the skilled nursing facility coverage with original Medicare, is preceded by a related 3-day inpatient hospital stay in order to get that coverage with original Medicare. It covers blood on an inpatient basis, hospice coverage, home health care, inpatient care in a religious non-medical care facility, in addition to that actual hospital stay, be it for medical or mental purposes. Paying for Part A. Most folks don't pay for Part A if they or their spouse have paid into Social Security at least 10 years. If an individual hasn't paid for that full 10-year period or more, there's a monthly premium that they can pay in order to get the coverage. And if someone didn't take Part A when they were first eligible for it, there is a penalty that they're subject to, a monthly penalty that can be as much as 10% of the cost of their Part A coverage. And if someone didn't take out that coverage when they were first eligible, you have to pay that higher premium for twice the number of years they could have had Part A, but didn't do it. So there are some monies involved with Part A, depending upon an individual circumstance. For most folks on Medicare, however, Part A is premium free. This gives you then the indication as to what Part A actually covers. Gee, John, you talked about the financial liability an individual has with these coverages if they only have original Medicare. This gives you the outline of that. The outline is what I'm trying to say. Where you have an annual deductible for Part B, but on Part A, it's a benefit period deductible, $1,484. So a person can spend that multiple or be subject to that multiple times in a year. They got a bad year health-wise. And depending upon how long they stay in the hospital, well, there are additional out-of-pocket expenditures that come into play there too. For 60 days, nothing out of pocket. But if an individual is in the hospital 61 days to 90 days, they got a daily co-insurance rate. If they're on just original Medicare, $389 a day. And then day 91, that doubles. And you only have so many lifetime reserve days that you can use when a person stays in the hospital for that extended period of time. 90 days is that limit, and you have 60 lifetime days that you can add to it. Once a person exhausts those lifetime reserve days, all the out-of-pocket costs are the responsibility of that beneficiary, and any additional costs that aren't authorized by the government for that. Similar type of coverages for an inpatient stay with mental health circumstances. The deductible is a little bit higher. The coverage is limited to 190 days lifetime, however. So some different limits that come into play with original Medicare on the base coverages. It does pay for skilled nursing fully for the first 20 days, next 80 days, a daily coinsurance of $190.50. Days beyond that, out of pocket. Some folks will confuse this with long-term care coverage. It's not. It's a stay in a facility for rehab or things of that nature, not a long-term coverage for nursing home care. Home health care, now that's covered completely under original Medicare, but there may be out-of-pocket expenditures for some of the supplies that are delivered during the course of that care. Durable medical equipment, canes, wheelchairs, walkers, oxygen equipment. That's out of pocket 20% to the beneficiary as well. Hospice care, covered completely. There may be some drug costs affiliated with it. It doesn't cover hospice care in certain living facilities. Well, what do you mean, John? If you're getting hospice care at home or through a nursing home, that's a different animal. Blood, well, everybody wants their piece of it, I guess, in a degree. But if the hospital gets blood from a blood bank at no charge, you don't have any charge. If they have to buy blood for you, they're going to charge you for that. You can help alleviate that situation for, well, many folks, if it's a planned procedure, will donate blood for themselves, and that is used, or other people can donate blood on their behalf to get around this cost. Benefit periods is a big thing with original Medicare, because how long you stay in a hospital, how long you stay in a skilled nursing facility, and then upon dismissal from those different avenues of care, well, that can start an additional benefit period. And that goes back to where I said that $1,484 is for each benefit period. You pay that a number of times throughout the year, no limit to the number of benefit periods a person can have, and they can span across calendar years. Does an individual need to sign up for Part A? Well, consider the fact it's free for most people. You can pay for it if your work history isn't sufficient. There may be penalties involved. It's important, however, for someone that is continuing to work, that they have a discussion with their benefits administrator at their place of employment to determine what all they need to do to make certain that they're covered, even if they have coverage through work, because this can be affected by the underlying Medicare coverage. Not can be, is. And it's important to note that if someone is contributing to a health savings account, an HSA, well, as they come and approach Medicare, they got to stop contributions there, because that can incur tax penalties through the IRS. Part B, those are the things we get outside of the hospital for the most part that are covered under these programs laid out for you. Most commonly, things that you see are the doctor services, of course, but also different tests that are done on an outpatient basis and care delivered outside of those circumstances. Preventative services, the government's doing a pretty good job of making these available. It's important to note that it's not a full physical. These are screenings for different conditions or programs that can help people with certain conditions like diabetes or certain, I'm trying to say here, different programs for different specific illnesses that there might be a program in play for it. This is a page taken directly from the Medicare and You book, and it's a very important piece that gives us the information as to what Medicare doesn't cover and is assumed covered by many people. Dental coverages, eye examinations and coverages, things for acupuncture or chiropractic is the word I was looking for. Long-term care is the biggie here, a very expensive piece. And folks need to realize that in order to get coverages on this, they need to go outside traditional Medicare systems with plans that are offered by companies that directly address these needs. Part B premium, and we're getting close here toward the end. Pardon me for going a little long. Part B premiums, well, the standard premium is $170.10 a month. As I mentioned, that's a 15% increase over last year. The years prior to that, two, 3 years prior to that, nominal increases at best. But for folks that may have been on Medicare for an extended period of time and receive different Social Security benefits, they may be held harmless from this rate increase. Doesn't affect a huge percentage of people, but you need to be aware of it. And this premium can be higher if someone didn't choose Part B when they first eligible, didn't have creditable coverage. And this, again, is a penalty of up to 10% for each 12-month period in which the person could have Part B and didn't take it. What if you make more money in that? Well, if your income is above $91,000 as an individual, $182,000 as a couple, you're going to pay more for it. And it goes up depending upon how much your income goes up as well. This is something to consider too when you see people who retire, sell a house and move to a different location, downsize, whatever it happens to be, and they have that chunk of money that comes through. Well, that can affect their premium cost based on that being considered income. And these numbers are for this year based on tax returns from 2 years ago. So some things that come into play. With the majority of people on Medicare well below this income amount, you won't see it with a bunch of people. But when you do, and you need to be aware of it and how it can affect programs moving forward. Because folks that are affected by IRMAA, the income related monthly adjustment amount, they may also pay a higher premium for the same drug plan someone of lower income pays for, or an MA program as well. Part B coverage does have an annual deductible in 2022. That's $233 a year. Not like Part A where it's per stay. This is an annual. And it also has 20% coinsurance for most covered services. So the individual, if they have just original Medicare, they've got 2 deductibles they have to be aware of and coinsurance on both types of coverages. Why would a person want this coverage? Well, even though most people pay a monthly premium that's deducted from other benefits they may be receiving or paying it directly to the government through 4 different ways of doing that, it may be a necessity for other coverages. So folks that continue to work, depending upon the size of the group that they are covered by, Part B might be a mandate in order to have full coverage there. And it is a mandate in order to have or purchase a Medicare supplement policy, the Medigap policies, or to join a Medicare Advantage plan, or folks that are on TRICARE, and as they become eligible for Medicare, for TRICARE for Life program, they got to have Part A and Part B to have those coverages, and CHAMP VA coverages as well. And as I mentioned, depending upon the size of the group, it's a necessity in many cases there. That's why communication with the plan administrator within your coverages there is a big deal. Veterans coverage, you will find many veterans that aren't eligible for TRICARE for Life defer Part B or decline it. If they were to pick it up later, they would be subject to the penalty. There are advantages for a veteran to have the coverage, and there are some folks that just simply choose not to. Anything else that's not given free, we're not doing it. We're not doing Part B. We're not doing Part D. They'll access those benefits through the VA. There are some cost advantages to that. There are some cost disadvantages to that. We have programs in play that help you totally understand the veterans programs. We'll make certain we have a link to the latest one of those. We have one scheduled next month too that can help talk to you about dealing with veterans in that circumstance. So once again, coverages on the different plan types, well, different coverage for different options that are available with it, and we want to make certain we know how they're paid for, because if someone declines Part B, well, gee, some of the coverages won't be there. So we need to make certain folks realize they have just original Medicare, what their out-of-pocket exposure is, and then we look then at the options that folks have. So this is the point in time where you're going to receive, as part of the follow-up, recordings for these additional sections. So we aren't on the phone much longer than what we are right now. This gives us, however, the opportunity to go into different locations and speak to these topics. These are pretty quick. In this presentation, lays out some different things, but we have full-blown presentations on each of these topics that are taken from the Medicare Learning Network that gives you the opportunity to present just on here's drug coverage through the government. Here's an option to cover a shortfall in just original Medicare, concentrating on Medicare supplement plans or on Medicare Advantage plans. A great way to walk through some of the different coverages that folks have available. And if you're active in what some refer to as the T65 market, the folks turning 65 or addressing folks that are just getting Medicare, great ways of presenting that and doing some things on a recurring basis so you establish not only your own knowledge base, but also create your reputation within your community as the subject matter expert in these areas. So you see that there is a ton of information in this. If you're going to use this as a presentation to the public, well, I talk a lot, obviously, as I've demonstrated today. I can talk pretty fast as well. It's not an hour. You can't get it in an hour without going through it or just skimming through everything. And that is counterproductive in certain circumstances for what you want to do. So let's look at why you want to do these programs through us. With Premier, we give you the opportunity to create your agent profile and assurance-based program that enables you to store your E&O, your errors and admissions coverage, answer questions for what are applicable with different contracts, establish that so you can do some contracting with carriers electronically too. There are certain carriers that don't participate in this program. Some of them, in order to expedite things, we need to get you that information directly through a link that goes directly to the carrier. In each of those areas, though, you need to protect yourself financially through errors and admissions coverage. We do discount that coverage for qualified agents through a program that you own. First off, what's a qualified agent? Well, that's someone who has a contract with us. This isn't, however, being a circumstance where you're added to a blanket E&O for just one program. You own this. It covers you with any carrier with whom you contract with through whomever you contract. So it isn't limited to just Premier. You can get a discounted rate if you do that. But if you go and have your coverages or your product portfolio through a number of different organizations, this will take care of you. We also offer discounted continuing education programs through our association with WebCE to keep your license in play. You can actually add to your own benefit package too through a modified guarantee issue disability income program that you're paid a commission on. Since as an independent broker, you're responsible for your own benefit package. Great way to make certain that your means to create an income can be covered there. Much as where today's presentation is being recorded, past presentations have been as well. I mentioned they are available on our website at premiersmi.com and on our YouTube channel as well. So you can go in and look at different carrier information, different topics within the industry of, gee, dental programs, John, give me an outline. Here's an explanation of that. Or I want to learn about ABC's company's specific offering for dental or hospital indemnity or for med subs, whatever it happens to be. And gee, what about all those lovely tools that you guys offer us? Well, demonstrations are available within this area as well. And that is a perfect segue into the Medicare Center program that's offered without cost to our contracted agents. Sorry, I'm an old MA guy. I have a hard time with the word free. They beat it into our heads that, hey, you don't use that word no matter what they say on television now. This is a program free to our agents. It has 3 quoting engines within it, all available under a single universal login, powered by Connecture, Sunfire, and CSG. It gives you the opportunity to make certain you stay compliant by gathering in the scopes of appointment through multiple means and storing them for that 10-year period that's required of you by law. It has a CRM within it, so you can stay on top of your prospects and clients and do those annual reviews about the drugs that I talked about. It gathers that, stores it for you. And It also has a resource center in there that even includes um, call scripts, things of that nature that can be very, very helpful for you. It also, within the CSG function, has a number of different tools in there to help you determine your market and to sell within that market as well. The Medicare Link and Medicare app, they center mostly on Medicare Advantage and PDP programs where you can do things electronically. This does that as well, but also a great amount of information for the Medicare supplement programs, so you can determine what you need as part of your portfolio in your target market and to sell through it. It also gives you the opportunity to fill in the gaps. So you run into a household, the Medicare Advantage plan, the person's basically looking for validation of their choice that they're not going to change. Well, if it's got hospital copays in it, you can designate that program and then tell them how much a hospital indemnity program is to fill in that gap. It's not a Medicare supplement. It's an ancillary program to cover that shortfall. You also see some detail in there for dental programs as well, even final expense. Keep in mind, scope of appointment for Medicare Advantage and PDP programs, you can't talk final expense that same appointment. You can for med subs. Many companies will give you additional incentives to work with them, and those are listed on a page on our website. So they're all together so you can understand what you're fully entitled to through your sales efforts, because those incentives, well, they may well help you qualify for different carrier trips and for incentive programs offered by our organization as well. We do have ways of getting you in front of people, contact list available where you can smile and dial. Can't do that for MA and PDP, but you can for Med Sup. You can for final expense. What we're seeing a number of agents do now with them is call 63 and a half, 64-year-olds and start speaking to them about additional dental coverage. Big way of creating your sales funnel for the T65 group. And most of the dental programs, they have a price increase at age 65. Great way of getting them in at a discount. We also lay out here different programs that help you maximize the value you get out of retail marketing. So if you're involved in Walmart, Kroger, CVS, whatever it happens to be, how can you make that pay for it? Or you get your best return on the dollars by the participation in those programs through different marketing activities there. We also speak to different means of approaching and working through faith-based organizations and with providers. There are carriers that will generate prospects. We have an internet lead program, direct mail support as well, and a T65 program that can help folks that are out in the neighborhood to do things. The referral programs here speaks to a way of reminding you how you can draw additional prospects out of a singular response. And that's important through the sales process, but also involving your book of business. We want to make certain that you have a diversification in your marketing efforts as well. We don't want all our eggs in one basket. Those direct mail programs, well, two of them discounted greatly the cost of mail and gives you the opportunity to do so consistently. We do so through preferred lead vendors that are vetted. These companies all have great CRMs, so you can access returns on that direct mail as quickly as possible. And we have oversight to make certain that communication is being handled in a compliant fashion. So it's not one of those, hey, we're going to give you a car if you return this mailer. No, it doesn't happen that way. We keep things compliant. We also have a program for folks that don't want the entire expense of a mail campaign or are just looking to plug holes in their schedule, and that is through untouched, fresh direct mail responses. The cost can and does vary from market to market and from time to time throughout the year, but it's a great way to fill holes in your calendar and reach out to people on a continuous basis that way as well. The internet lead programs through Facebook. We have one set up for final expense and Medicare. Medicare deals mostly with the overall overview and Medicare supplement programs to make certain we stay in compliance. At T65 Locator, it's a program you download to your smartphone, register. We find that you're contracted with us. It kicks this into play where you can actually see in a particular area who's turning 65 at what time period. Great way if you're one of those folks that don't mind going up and knocking on someone's door. Hey, I got a great dental program for you. You're interested in final expense? I can do a review on your Medicare supplement programs. Obviously, you do not want a door knock for Medicare Advantage or prescription drug plans. That'll get that contract yanked pretty quickly by the carrier, but a great tool to help in other areas. We want to make certain too that you engage your book of business on an ongoing basis. We want to drive up your persistency and retention. And so reaching out to folks with an item of value on a regular basis can make a big difference. And that includes asking them for referrals. All this said and done in a long presentation, I apologize. We do so because we want your business. We want to be referable for you. We want to get started with Medicare with you as well. And so if that's applicable for you and your situation, take and put it in play now. You don't have to wait. There are programs that can get you up and selling fairly quickly, and there's no reason to delay it. All that said and done, you can visit with us at or through our toll-free number 1-800-365-8208. You can visit us through our website at premiersmi.com. You can respond to the email you'll be receiving as follow-up to today's webinar, and we'll make certain that we help you along the way with this process through the different programs that are available to you. For those of you, however, that have worked with us in the past, I thank you for your business. For those of you considering working with us in the future, I thank you for that opportunity. But as I gobble up more and more of your time, I thank you for the use of that time, that investment, that powerful investment of your most valuable resource. And so, checking really quickly to make certain any questions that come in have been covered. They have. I thank you for that. And until we're able to speak again, I wish you good selling. Thanks so much. We'll talk to you soon.